Okay, good morning, everybody. My name is Michael McKee, and professor here at University of Michigan, and I'm with the Department of Family Medicine, and also have a secondary appointment at Physical Medicine Rehabilitation. And I am delighted and honored to be here to kick this off, and this is our sixth annual Disability Health Research Symposium. And this has been hosted by the Center for Disability Health and Wellness, and I'm an associate director for CDHW and also working closely with Dr. Michelle Mead, who is our director. Please advance the slide. So the upcoming events and opportunities, I want to make sure everybody's aware of some of the things that will be coming up. So we do have monthly on the second Thursday of the month. These are open office hours, and that's available for anybody who wants to join, needs technical assistance on various disability health projects. We also will have our Martin Luther King observance event. So the MLK event is now scheduled for January 22nd on next year, and this will be from 12 to 2. Please save the calendar for this virtual event, and there will be more information shared shortly. Disability healthcare best practices and provider training, that will be also scheduled on April 16 and 17. This is really going to be focused on clinicians interested in improving the care for people with disabilities. And then lastly, a CDHW Disability Healthcare Resource Event and Research Symposium that is scheduled now for October 4 and 6 next year in 2026. Thank you. Next slide. So we have a few housekeeping rules. So I want to make sure that this event will be recorded. All attendees will be muted with the exception of the presenter. And in terms of the presenters, we will have them introduce themselves. We are delighted to have a keynote speaker later, which we will introduce. And it's important to make sure that we speak clearly so that not only our interpreters, but also for our transcription to capture what is being shared. If you have questions and answers, so if you have questions you want to pose, please use the Q&A and we will address them in the order that they are put into. And then state your name prior to speaking so that way we know who you are. And this also helps with anybody who might have limited vision, low vision, or blind. And lastly, but not least, please fill out your evaluation at the end. We really appreciate your feedback. Next slide. Okay. So the mission and vision, CDHW works in partnership with the disability community, and the goal is really to innovate, educate, amplify, and implement a lot of the work that many of us are doing. And we're really particularly interested in some of the new things that we're learning in research, education, and also with clinical advocacy. The whole intent for this is really to improve the health and wellness of people with disabilities. And we are very interested and really devoted to also paying attention to intersectional identities and helping connect people, network, and make sure that these ideas and opportunities are not just within Michigan Medicine and University of Michigan, but we want this to get out, whether it's the state of Michigan or beyond. Next slide. So CDHW actually has some really strong cores I want to make sure everybody's aware of, and that's with research. There are various projects that are very interdisciplinary, and what we're trying to do is get those research, some of the findings that we have, make sure that those are translated. There's a knowledge and translation core. We are also very interested in training. Training could be for researchers and also could be for clinicians. And then last but not least, we are really interested in having a lot of these networking and opportunities for people to kind of share some ideas. Okay. So just briefly, the research, we have several research activities. Again, as I mentioned, we're very interested in equities and healthcare access, quality, health outcomes for these individuals. We have more of a focus on physical, sensory, cognitive, and developmental disabilities across the lifespan. does not mean that we only focus on these individuals, but many of our projects are more focused on this. Next slide, please. So want to also make sure everybody's aware, we are very honored and blessed to have funding through the National Institutes of Disability, Independent Living, and Rehabilitation Research. So NIDILRR has funded several projects, and one I'm going to mention in addition to the others is the HEAD DC RRTC. So this is a training center grant and is focused on really improving the equity and health and functioning for adults with physical, cognitive, sensory, developmental disabilities from diverse communities. And next slide. There is a second project that is also funded, and this is one of 18 NIDILRR's funded spinal cord injury model system centers, and this is Michigan SIMS, and Dr. Michelle Mead is the PI, along with Dr. Gianna Rodriguez and Dr. Jonathan Vanderberg. And next slide. And then, sorry, okay. The next one is the Rapid RRTC. So this is another project that Dr. Michelle Mead is also working closely with Dr. James Krause. And this is a group in South Carolina and examines the health and function of adults aging with different diagnoses associated with physical disability too. And so these different training grants really give us a lot of infrastructure, a lot of robust activities in research, community engagement, and training activities. And please go to the next slide. So I'm going to just briefly go through this because I want to make sure we go through our exciting panelists and presenters later. So the next one is the knowledge translation products. We have several activities that are available, whether it's online, we have social media, brief videos. There's also a number of publications. Some of them are peer review and some are more focused on media-based articles, podcasts, research briefs, visual abstracts, and then we also have this annual Disability Research Symposium. And so in terms of what we're trying to do is really influence not only researchers and clinicians, but our policymakers. And so we have a pretty strong area in terms of partnership with the policymakers and policy briefs activities. Thank you. And next slide. We have capacity building training activities, and this is really devoted to help community members who have a disability themselves or lived experiences, and they want to work closely with researchers and clinicians. And we have various activities to help them learn the different research elements, whether it's institutional review board and so on. So there are opportunities if you want to get more involved, you want to be a partner in this research activities, please feel free to reach out. And next one, please. And then we have technical assistance approaches. And again, we have open hours. This is really just to help be able to sit alongside with you and provide some guidance. And this can be for people who are in the community, can also be for clinicians, researchers, and so on. Next slide. Then the other component is the clinical training. We have several areas where they're more focused on helping medical students. We also have annual course that's available, and the goal is to really try to influence and educate trainees in different areas, whether that's pharmacy, occupational therapy, medical school. And then we are also working with primary care, especially in residency training and standardized patient programs. These are also available, whether it's tip sheets, resources, videos, and we're educating community members to be alongside as educators too. And next. And then last but not least, we really value the partnerships with different disability health organizations and also our community members. And so we have a community advisory board, and this also is an opportunity for you to get involved. If you are interested, please reach out. So we're very thankful for our community advisory board members that help guide our research and our various activities here. We have grant partnerships with community organizations. Many of them are directly involved with activities. We have education training of community organizations, and we have outreach and engagement of community organizations. So what we're really trying to do is make sure that we are working alongside with each other because we not only learn some of the inequities, gaps that exist, but they also educate some of the best practices to be able to work with these various individuals. And then what we do want to do is also really help these community members to basically distribute, disseminate some of the findings and best practices that we have. So let's go to the next slide. So what we're hoping to do today is really increase awareness and discussion and collaboration between researchers, research participants, and community partners. And this is really learning how can we team together to tackle. We know there are many issues, but we are also excited to show some of the best practices, findings that I am optimistic that can actually tackle and address some of these inequities. So we're going to go ahead and move with the schedule. So we're going to be kicking off. We have four presenters coming up, and they're going to share some of the projects that they were involved with and some of the findings. And we're also going to take a brief break before we go into the keynote. And so we'll kind of guide everybody as we go through the schedule. This is going to be an exciting day, and so we look forward to learning more. And thank you.